Hi guys, I just got off of work, 12-hour. This video is on what is the difference between a patient care tech and a nurse tech. So let's get into it. Now, first things first, there are two major differences between a patient care tech and a nurse tech. The first difference is qualifications. The second difference is job function. Just a slight difference.
And I just found a patient's hair on me.
The qualifications to become a patient care tech are you must have a high school diploma or equivalent, a certified nursing assistant license or patient care tech license, and you must maintain a current basic life support card. The qualifications of a nurse tech are you must have a high school diploma or equivalent, you must be currently enrolled and attending an accredited nursing program where you have completed at least one semester, and you must be certified in basic life support. Now, when it comes down to job functions, patient care techs and nurse techs do the same things. The only slight difference is that a nurse tech, since you are a student nurse, you are able to do more. You're actually able to do the skills that you learn in nursing school. In nursing school, you'll have a skills competency checklist, and whatever you have passed or competent in, you should be able to do as a nurse tech.
Under the supervision of a registered nurse, okay?
So here are some of the similar job functions that a patient care tech and a nurse tech have to do. Communicate patient information, maintain a patient's hygiene, specimen collections, patient data collection, response to patient needs, patient transportation, documentation, assisting patients with their activities of daily living, nutritional and dietary needs, elimination needs, physical activity needs, and all other comfort measures. You must obtain and document vital signs, pass ice water every 4 hours, keep the patient's room stocked with gloves, the sharps container empty, make sure there's linens, small towels, any briefs. If the patient uses a brief, make sure that everything pertaining to this patient is in the room, easy access, so you're not in and out. And you're doing this all together while you as the nurse tech or patient care tech have your responsibility to complete. You also have the nurses calling you and call lights going off all at the same time. And you yourself must be a self-thinker to say, what am I going to be able to do right now? What am I going to be able to do after this? And what am I going to have to say no to? I cannot do it. You will be communicating with nurses and with other staff, lab techs. You'll be communicating with the doctors if they have any questions about a patient's care. You'll be communicating with a patient's family. So it's very important that you watch and you assess situations and you don't just do, but you actually think as you do, because you're a big part of the hospital community. You're a big part of the job. When you're a patient care tech or a nurse tech in a hospital, you don't know what you're going to get when you come in. You can be either a sitter for a Baker Act patient. You can either be floated to another floor. I've been floated to ICU, ER, PCU.
I've been floated to every floor in my hospital, every crevice and corner.
So being a nurse tech, being in nursing school and knowing what I know, having the knowledge, the skills, I'm able to understand my job better, do my job better, and in turn, when I become an RN, I'm that much more strengthened in the areas of hygiene and basic care and moving a patient from the bed to the chair and changing a patient's brief and really just focusing on care. Because when you're an RN or when you're an LPN, when you're a nurse, you still care for your patient. You are a CNA and a RN, or a CNA and an LPN.